Good evening and a very warm welcome to all of you in this interactive session, which today is on a very special topic, the name of which is Scleroderma. Now, Scleroderma, whenever we talk about this disease, it is a rare phenomena, and the exact problems that are being faced by the patient of Scleroderma can be felt only by someone who is suffering from it. For a layman, it might seem a simple skin disorder, and that is why in majority of the patients suffering from Scleroderma, when the patient initially starts going to doctors for treatment, in the initial part of the treatment, the doctors, many of them, they will give the normal skin related medications to the patient. It's only after a lot of changing of doctors, physicians, and when the patient does not get good recovery, that gradually the ANA test, anti-nuclear antibodies test of the patient is done, and finally a person is diagnosed for having Scleroderma. Unluckily, even when a person comes to know that he or she is having Scleroderma, there is nothing much that the allopathic world can offer to that person. Now, why and what exactly is Scleroderma? I am showing you the pics and images of hand in Scleroderma. Although it is a disease of connective tissue, it is a disease which is a disease of connective tissue, and not just the skin, but lot many other parts of the body are also affected when we talk about Scleroderma. Joints can be affected, where the patient can have a pain in the joints, a person can have swollen joints. The patient will also have a difficulty, many of them, in opening up the mouth properly. The jaw won't open up in a patient suffering from Scleroderma. In many patients, the peripheral blood vessels also constrict. And since the peripheral blood vessels also constrict in many patients, so that is why the patient can have problems related to microcirculation and blood circulation in the extremities. I am showing you an image over here where you can see that gastrointestinal tract can be affected. The symptoms, there are so many symptoms. The symptoms can be mild, the symptoms can be moderate. There can be symptoms varying from person to person when we talk about a person who is suffering from Scleroderma. The symptoms, there can be a varied number of symptoms, but yes, the involvement of skin, that is something which is very common whenever we talk about patients suffering from Scleroderma. As you can see, why it occurs is, it occurs when the body begins to overproduce collagen and it accumulates in the tissues. Collagen is the main structural protein that makes up all the tissues. So collagen otherwise is required by our body. It makes all the tissues inside the body, but once excessive collagen begins to accumulate in the tissues, Scleroderma starts, and the symptoms can be varied, as I just told. It can be hair loss, there can be calcium deposits or white lumps can be there under the skin. Then there can be joints pain, there can be esophageal reflux, abdominal bloating after meals, shortness of breath, diarrhea. There can be so many symptoms, so many varied symptoms when we talk about Scleroderma. So that is why when a person starts suffering from Scleroderma, it is very agonizing disease. In some patients, the symptoms will be mild, which can be ignored or which can be managed, but in most of the others, the symptoms are really severe and it really causes a problem for the person carrying on with the normal lifestyle. Now, talking about the prognosis, what exactly is the prognosis of Scleroderma in allopathy? So when we talk about the prognosis of Scleroderma, there is only symptomatic treatment that is given in allopathy in patients of Scleroderma. That is why it is more of management rather than the treatment that is done. And on the other hand, those diagnosed with advanced and systemic version of disease have a prognosis of anywhere from 3 to 15 years. So such is the extent to which Scleroderma can cause problem, that in extreme cases, the life expectancy of the disease, the patient, is also decreased when he or she is suffering from scleroderma. That is why the hope, it lies in Ayurveda, and that is why it needs to be tackled the Ayurvedic way. Now, when we talk about scleroderma in Ayurveda, so the first thing, when we talk about scleroderma, what exactly is the disease with which we can compare scleroderma? So the disease in Ayurveda is Utan Vat Rakt. Now Vat Rakt is a disease in Ayurveda which is otherwise a synonym for gouty arthritis. In gouty arthritis, it is said that the person is suffering from Vat Rakt. The uric acid increases, there are various problems that the person feels, and that Vat Rakt, when it is there in the superficial tissues in Ayurveda, it is known as Utan Vat Rakt, and that is why the symptoms are very much similar to scleroderma. If we go in the further depth, Vat, Pitta and Kapha, they are the three doshas of the body, and it is believed that when three doshas with predominant Vayu is the main dosha, and the rest of the doshas are the associated doshas, when they affect the Rakta Dhatu, the Mas Dhatu, and along with that the Ras Dhatu, when they affect these primary three dhatus, the disease which occurs is known as scleroderma. Now in Ayurveda, the hope really lies in Ayurveda, and there is a lot of research also that has been done for this disease over the years. And when we talk about the herbs, the classical herbs which can work in scleroderma, there are many, and I will be coming back to them. But then I would also like to tell that in case we want scleroderma to be completely covered, I mean, if we want a person to come out of scleroderma, it is Ayurvedic Shaman Chikitsa and Ayurvedic Shodhan Chikitsa. Both of them that combined, if used, can bring a person out of this condition. So what exactly can be done? First of all, I will come to Shodhan. When we talk about Shodhan, it is the procedure with which the body is detoxified of the toxins which are already there inside the body, and the microchannels of the body are also purified in the process. So the Shodhan, Panchkarma is a part of Shodhan, and when we talk about Shodhan, the Shodhan procedure which is very good for scleroderma, I like to share the role of Panchkarma in scleroderma with you, as you can also see in the slide which is forwarded your way. Virechanam is the major karma. Virechanam, the most important Panchkarma therapy that needs to be done in a patient suffering from scleroderma is Virechan. Now what exactly is Virechan? The person is given a special kind of medicated ghee to be consumed along with a combination of herbs. The person consumes that medicated ghee for 2 days, 3 days, 4 days under the guidelines of a trained Ayurvedic physician, which we do over here for our patients. And then once the Samyag Sneha Lakshanam, there are certain signs with which we can know that the person has been provided the requisite amount of that medicated ghee as per the body type of the person. So when those signs start to appear inside the body of the patient is then given Snehan and Swedan. Snehan, the external variation, the body massage with a medicated oil, and then steaming is given, and then the person is given a combination which causes purgation in the patient. So with that medicated purgation, a lot of toxins are thrown out of the body, and once that is done, immediately after that, the Shaman Chikitsa of Ayurveda, which contains lot many herbs, lot many minerals, are added, and they give very good recovery over there. Aragvada. Aragvada is one of the drug of choice, one of the best herbs which is required over here. Aragvada is also known as Rajvriksha. Rajvriksha, the yellow flower tree which we often see on the sides of roads here in India, especially in North India. That Aragvad is one of the best herb when we talk about giving treatment to a patient suffering from scleroderma. Acacia fistula is the botanical name for Aragvad. The second is Khadir. Khadir, which is also known as Acacia catechu, is again very good herb for patients suffering from scleroderma. The third is Bhunimba. When we talk about Bhunimba, it is Andrographis paniculata. Now, Andrographis paniculata once again is a very good herb when we are to give recovery in patients who are suffering from scleroderma. Coming to the next group of herbs for scleroderma, the herbs are the common ones. Neem, which you all must have heard of. Neem is a very common herb. Aza directa indica, which is one of the best blood purifiers, and the neem gives a very good recovery in patients suffering from scleroderma. And Chiraita, which is also known as Swastia chiraita, is again a good herb for patients suffering from scleroderma. So what we generally do is, we generally advise our patients to go for these herbs around the globe. Patients, when they approach us, we do the dosha analysis from them. Our team of doctors, it does the dosha analysis, and that is done absolutely free of cost. And then the particular kind of shodhan and shaman treatment is guided to the patient, which gives a very good recovery. The herbs, at times it becomes tough for the patient to procure all those herbs and take those herbs. We are having some combinations also in case of those patients, and the major combination is golden shower capsules. Now, when we talk about golden shower capsules for a patient who is suffering from scleroderma, the best part of golden shower capsules is that the herbs which I just mentioned, which are very good for a patient suffering from scleroderma and the patient requires to take it, it's not those herbs only for scleroderma that are available in these golden shower capsules, but along with those herbs, the minerals which I am going to mention is Jahar Mohra Pishti. Now, Jahar Mohra Pishti is a pishti which is required for a patient of scleroderma for the skin softening, for balancing the gastrointestinal tract problems. So those minerals are really very important. That is why we have added Jahar Mohra Pishti also in golden shower capsules. So if you are suffering from scleroderma, what I would like to assure you over here is that in Ayurveda, if you go for the right kind of treatment, shaman as well as shodhan, not just that we run after medications, we do not take guidelines from a doctor, because when I have patients coming to me for scleroderma from around the globe, I see they have tried a number of supplements. Many of the herbs which they have taken are already good, but it's not just about the herbs which are good for scleroderma, but a doctor who knows and who can guide that in what dosage, in what procedure, exactly those herbs are to be taken that can bring a person out of scleroderma.